group of drugs which we'll be discussing. Now for the next category of drugs or classification of drugs which we'll be discussing are a set of drugs that are known as the Parasympathomimetics and the Parasympatholytics. Right? So there are actually two types of drugs. Okay, Parasympathomimetics, of course, they should be acting on the parasympathetic nervous system, while the Parasympatholytics, no, all of them is parasympathetic nervous system, right? But one will activate, one will actually, decrease its activities. Okay, so let's look at these drugs. So first of all, you should know that the two classes of drugs, they affect mainly the parasympathetic nervous system. That's the nervous system that is outside the brain and the spinal cord. Okay, so this is the branch of the autonomic nervous system that is responsible for what? Rest, you calming down, and also you assimilating food. So you should know that this parasympathetic nervous system, for the nerves involved in this system to be able to communicate, they use what? Acetylcholine as their primary mode of communication. That's their neurotransmitter. Okay, so let's look at the drugs now. So if you say a drug is a parasympathomimetic, this drug will mimic or increase the effect of the parasympathetic nervous system. That means what? The effect of the parasympathetic nervous system is mainly for rest. So if you give such drugs, it will calm your whole body down, it will slow down heart rate, it will stimulate more digestion, it will make glands to be secretion, like it will give peace to your body. So mechanism of action, they mimic acetylcholine and they will bind to most of the cholinergic receptors, thereby bringing much of the effect. So what are the classification? We have the direct acting ones, okay, like Pilocarpine, Bethanechol. Those ones, they directly activate the receptors. While we have the indirect acting ones. So there's an enzyme known as what? Acetylcholinesterase. This enzyme normally should break down the acetylcholine. So these ones, they'll go and attack that enzyme so that acetylcholine will have its way. So have drugs like the Neostigmine, we have the Donepezil. So clinical uses mainly to relax the body. So any disease condition that is trying to actually tense up the body, use these drugs so that it will relax it. Glaucoma, where there is increased pressure in the eye, to relax it. Urinary retention, where there is so much pressure in the urinary system, to relax it. Myasthenia gravis, to relax it. Alzheimer's disease, where you will have all those seizures and all of that, to relax the whole condition. Then what is parasympatholytics? So parasympatholytics, you should know that they are also known as what? Anticholinergics and anti-muscarinics. Those drugs, they are the opposites. So these ones will reduce the activities of the parasympathetic nervous system. Okay, so instead of resting up the body, they will reduce the rest. They'll keep the body into motion. They'll keep the body into activity. Right. So their mechanism, they could block the receptors. You understand? They block the receptors. So we have drugs like the atropine, scopolamine, oxybutynin. You understand? So most of them, if the body is acting slow, they activate it. If the heart is beating slow, they activate it. If the eyes is getting too large, okay, they activate the eye so that the eye will constrict. A lot of things, right? Just the opposites. Okay, so there's bradycardia. So after an anesthesia, they gave you things that actually paralyzed your body. So after the surgery, they want to now activate the body again. They mostly use the parasympatholytics. So that's what we have for these two classes of drugs.